Good afternoon. I'm Joni Monzo. I'm here with our noted radiation oncologist, Dr. Matt Bertke, and we're here today, Cancer Conversations with OHC, to talk about Head and Neck Cancer Awareness Month. Dr. Bertke, thank you for joining us.
Yeah, thanks for having me.
Well, I think we'll get right into the conversation because I know that many of our radiation oncologists have told us that they've seen an increase in head and neck cancer over the last several years, and we'll get into that. But first of all, when we talk about head and neck cancer, what structures are we actually referring to?
Sure, Joni. We're talking about cancers that develop in the head and neck. So we're talking about the nasal cavity, the throat, the mouth, the voice box, but we're not referring to the eye or the brain, really just kind of in the head and neck region below the brain.
Okay, so when someone's referring to brain cancer, they're not referencing head and neck cancer?
Correct.
Okay. What are some of the risk factors that would possibly put someone either at risk or family history or lifestyle activities that they do?
So a lot of the risk factors for head and neck cancer are dealing with things that cause irritation in the head and neck. So the biggest things that we think about are tobacco use, and that can be either smoking or smokeless tobacco, as well as alcohol use. But more and more prevalently, there's also different types of head and neck cancer that can be caused by viruses that can be either sexually transmitted diseases or other viruses.
And we've heard a lot of conversation, one being the HPV virus.
Correct. So that's taken over, at least in throat cancers, as one of the leading causes of cancer, even overtaking smoking. So it's something that is obviously concerning to us when we see more cancer from something that we can hopefully prevent, and that's one of the reasons we'll talk about possibly a vaccine for HPV later in the talk today.
Okay, perfect. Can you tell our viewers what would be some of the signs or symptoms they should look for with head and neck cancer?
Right. So when you're looking for things to be concerned about, the largest thing that people notice first of all is a lump in the neck, so a swelling that doesn't go away. Other things to be on the lookout for are either a red or white patch in the mouth or throat, something that feels like it's a non-healing area in the mouth or throat, or things like swelling of the tongue, changes in your speech, or difficulty with movement of the tongue are common ways that we find this.
And I know that for many of us, when we go for our yearly dental appointment and the dentist comes in and checks your oral cavity after the cleaning, they're obviously also looking for any sort of signs or symptoms of any sores.
Right. So, there's no standardized screening test for head and neck cancer, but the closest thing and the best thing that we have is regular dental visits. And, regular dental care is also something that helps reduce the chance of developing head and neck cancer, and also having a trained professional look inside the mouth for anything that's developing and catch it while it's small is helpful.
Now, with this cancer, if caught early, is it curable?
Yes, most head and neck cancers we do treat with the intention of curing, and as long as we catch it while it's still in the head and neck, these are usually cancers that are curable. So, like you mentioned, catching it early is the important factor.
Okay. What are some of the typical treatments as a radiation oncologist and working with your colleagues here at OHC? How would one treat head and neck cancer?
Right. So, head and neck cancer is a cancer that really brings in the team approach that we take here at OHC with treating cancer, because it's a cancer that's typically treated with 2 or 3 different modalities or types of treatment. So, surgery can be used, chemotherapy can be used, and radiation can be used in the upfront treatment of head and neck cancer, or a combination of 2 or all 3.
And I know prior to us going live, we were discussing clinical trials at OHC because it's always something that our doctors look to for our patients. Tell us a little bit about the clinical trials at OHC for head and neck cancer.
Certainly. So obviously cancer doesn't rest, so we can't rest on it either. So at OHC, we have a fairly large group of trials that are looking at targeted therapies, and these are newer drugs that are looking at specifically analyzing a tumor's genetic makeup and targeting those abnormalities in the tumor's genes. So some very exciting trials that we have are looking at a patient's specific tumor and then analyzing it for an abnormality or something that we can target. And our trials allow us to pick different agents that target the specific abnormality in a certain patient's tumor. So it's a way to really tailor therapy toward a specific patient rather than doing a, catch-all approach.
Which has really changed the landscape of how we take care of patients and how we treat cancers. It really truly is personalized and individualized based on that patient's tumor and its genetic makeup and how it reacts to different treatments.
Exactly. I think personalized medicine here is something that we put at the forefront at OHC, and that's everything from our personalized radiation planning to picking the correct types of chemotherapies or systemic therapies based on a patient's very specific tumor.
Which is wonderful. Well, let's talk about, as you had mentioned with vaccines, let's talk about the prevention, because we know that there are certain things that we can do starting at an early age to make an impact on our overall health, but surely with head and neck cancer, what are things that our viewers could start today and also share with their family members?
So obviously things, if tobacco use and alcohol use are big contributors to head and neck cancer, abstaining from those, trying to quit or at least cut back is, an easy first step to do in terms of, something that a patient can do themselves and can take action on. When we mention especially some of the throat cancers that are more and more often today caused by viruses like HPV, there are vaccines specifically for HPV that the idea would be that you can prevent not only genital and sexually transmitted HPV, but prevent some cancers, including cervical and head and neck cancers. So, for males and females as young as 9 and up into the 40s, it's a recommended thing to do and something that certainly would reduce your cancer risk.
I know that our gynecologic oncologists have those conversations often with their patients, as do all of our doctors. And surely those that are watching our video today, pediatricians, family practice providers are all having those conversations with the parents and with young adults. And as you said, it can start as young as age 9. So we highly encourage consideration of vaccinations.
And our hope is that allows us to see less and less cancer as time goes on, but for the time being, we're working very hard on targeted therapies and things that we can do even if the cancer comes up.
Good advice. With head and neck cancer, and I know that we talked about chemotherapy, but also talking about targeted therapies, we've also seen a change just with the immunotherapies and drugs that are actually helping in treatments to help the patient's own immune system fight their cancer. And we're using those as well as in head and neck cancer. Right.
So immunotherapies are another form of systemic or kind of body-wide therapy that you can utilize, and like you said, Joni, it is using the body's own immune system and the power that you have in your immune system to actually unlock it to fight the cancer. One of the difficult things about cancer is it usually has ways to hide from the immune system, and the idea behind immunotherapy is that you unmask the cancer and allow the immune system to actually go after it.
Yeah, and we've had great success, I know, through our clinical trials program with immunotherapy. I know last year, because of COVID, we have been running head and neck cancer screenings in the community, and unfortunately had to cancel those. So we are hoping that this fall we'll be able to offer those to our community at no cost, free. And I know that you, Dr. Bertke, will be involved in those. So we encourage everyone to go to our website, ohcare.com, to look at our calendar events to make sure that you don't miss those. Anything else that you'd like to share with our viewers about head and neck cancer or cancer in general?
So I would just like to say that, kind of like all cancers, it's important to catch cancer early. So head and neck cancer is certainly one of those where It's something that we treat with the intention of curing and do a pretty good job of curing it, but it gets to be a harder and harder task if it's something that's advanced or let go. So if you're concerned about something, don't be afraid to go to your doctor and have it looked into. Even with COVID right now, we'd rather you have something checked out early than let it go for too long.
Great advice, and I know that's been something we've been sharing all year, that that with COVID, that if you are having symptoms, do not delay in seeking medical advice from your provider.
Certainly.
Well, thank you, Dr. Bertke. It's a pleasure. Appreciate your time. If you have any questions or would like to learn more about OHC, please go to ohcare.com, or you can call us at 751-2273 or 751-CARE. Next month, we will have Dr. David Pratt, another wonderful radiation oncologist, to talk about brain cancer, as May is National Brain Cancer Awareness Month. Thank you for joining us.